जे अतिथी आसात, एक्सपर्ट गेस्ट आसात ते आसा डॉक्टर विक्टर कोएलो, जे कन्सल्टंट युरोलॉजिस्ट म्हणजे मुतखड्याच्या दुयेंसांचे तज्ञ दोतोर जावन आसात विक्टर हॉस्पिटलाचे.
We do not recommend that you do not take seafood completely. That is very, very difficult
Correct.
for any goenkar to tell that don't take nusta or don't take any fish. Previously, it was wrong concept to think that certain vegetable like tomato, which has little small
Correct.
seeds in it.
Yeah.
Initially, we also were thought that don't take that diet.
Doctor, once you are detected or once you are diagnosed, now we are coming to the modality of treatment.
So the modalities of treatment is broadly based on the size of the stone and the location of the stone.
How much water should be consumed?
Yes. So the water consumption and hydration is the most important thing in preventing renal stone formation.
If you consume beer regularly or SOS, there are most probability that since there is a good flow of urine, your stone will pass off or they will not form. What is your take on this?
That doesn't mean if you don't consume enough amount of water, the stone will not pass.
Correct.